Hello, my name is Dr. John Lay with Lay Renew. Today, I want to show you a video of a client who wants to look more refreshed before a big event in the next couple of weeks. I will be using a filler called RHA, which is designed for a more natural look, especially in dynamic areas such as around the mouth. To minimize bruising, I will be using a lot of cannulas. Let's begin. This is a preview of what she looks like before and after. There is volume loss in the mid-face, skin laxity resulting in deep nasolabial and marionette folds, perioral wrinkles, and mild thin lips. First, I start in the upper cheek to mid-face. Small amounts of RHA4 are placed supraperiosteal with a needle to give some projection, especially the mid-cheek groove. Next, I change to a 25 gauge 40mm cannula and contour her left upper face from the zygoma to mid-face area. Restoring volume in this area helps to lift up her face. Here, I am blending in the malar mound to mid-face. From this origin, I sometimes go more superiorly to restore the soothe fat pad, or more medially towards the teardrop. Strands of the filler are placed more superficially compared to the needle earlier. I am using my left index finger to help guide my position and depth. You need to slow down and be more cautious if you approach more immediately towards the infraorbital foramen and vessels. When repositioning the cannula, make sure you withdraw almost to the tip, otherwise it will bend and you will not be in the right plane. With the cannula, I can do more fanning and treat the nasolabial folds at different depths. With the needle, I have to be more cautious of the facial artery, so injecting deep to bone in the piriform fossa would be another option. Here, I am blending in towards the upper lip area a little. RHA 3 or 4 are good options here. To treat the vertical lip lines, I switch to a 27 gauge cannula and RHA redensity. From the same entry point for the nasolabial fold, I like to spread out thin strands more superficially. Using RHA redensity is great here since it is thin and very dynamic. Still, I want to avoid overfilling this area. For this client, I can also add even more superficial intradermal injections with a 31 gauge needle, but she has an event soon, so I want to avoid causing too many bruises. For the upper lip mucosa, RHA 3 is ideal for someone who wants nice, full, plump lips. For a more conservative look, RHA 2 or redensity are good options. This client prefers a very subtle look, so redensity is great to create that soft and hydrated look. For comparison, it would be similar to using Juvederm Volbella. I usually use a 30 gauge needle to place vertical strands to evert the lip a little, but here I want to demonstrate the use of a cannula and to minimize bruising. I make an entry point at the corner along the vermilion border. The lower lip is treated in a similar fashion. To reduce the appearance of her jowls, I place some filler along the posterior jawline, starting at the gonial angle. Avoid the facial artery by identifying the notch on the mandible. Sometimes I go back with a cannula to blend in this area, especially if I'm trying to create more definition. A high G prime filler such as RJ4 or Volux is ideal. Now I go back to the cannula to contour the chin area. The goal is to create a more straight line across the pre-jowl sulcus. From this entry point, I can also support the corner of the lip with a little filler or even the horizontal chin line. This area can be sensitive for the client, so you may want to slow down a little. At the halfway point, the client sits up to see the difference between the two sides. I believe her left side looks more lifted with softening of the nasolabial fold, jowl, and marionette folds. I think she still needs a little more filler in the mid-face anteriorly, which I completed later on. For the right side, similar injections are repeated. For the sake of time, the video will be sped up a little more. Again, I am using RJ4 to contour the cheek to mid-face. In my hands, RJ4 is very versatile. I can use it in the cheek, mid-face, nasolabial folds, chin, and jawline. There is 1.2 ml per syringe. and that's 20% more than a comparable Juvederm or Restylane syringe. After the right nasolabial fold, it's not shown here, but I also use Redensity again to treat the vertical lip lines. Right upper lip with Redensity and Cannula. This filler is light and very dynamic, so it spreads very well and massaging the area smooths it out afterwards. You can place a little filler along the Vilmian border, and here I think less is better. Many of you are familiar with the 1/3 to 2/3 ratio, and I think it's a good idea here. Cannula used to treat the marionette to oral commissure. For more superficial lines, I sometimes go back with a needle. For significant laxity or folds here, consider a thread lift. Contouring the chin area to reduce the appearance of the jowl. The filler injections are finally done. One quick look before Daxify. This will be sped up again. Treating the Jowl or depressor anguli oris muscles. Finally, we're all done. Let's look at the before and after pictures. There's lifting of her cheek, softening of her nasolabial and marionette folds. Her jowls appear reduced as well. Sometimes it happens, but I don't see any significant bruising, even after all those injections. This client was pleased with her injections afterwards. If I could add anything later, it would be more intradermal injections for the superficial lines around her mouth. This will be shown on another video, so stay tuned. Thank you very much for your time.